Hi, I'm Warwick Suskin. I work closely with practitioners around blood analysis and clinical decision making. Another thing practitioners often tell me is this: I've done everything right and nothing is changing. The protocols make sense on paper, the supplements are appropriate, the lab results even look like they should respond. And yet the patient feels the same or sometimes even worse. When that happens, the instinct is usually to escalate, add more, change doses, introduce another layer. What's uncomfortable in that this moment often gets interpreted as failure, either of the protocol or of the practitioner. But in many cases, that interpretation is wrong. Often the issue isn't that the protocol is incorrect, it's that the system isn't ready to respond. Things like chronic stress, poor sleep, nervous system overload, unresolved threat, these create a kind of biological ceiling. Until that ceiling shifts, even well-designed intervention struggles to land. This is why escalations can sometimes make things worse rather than better. You're adding complexity to a system that's already at capacity. At this point, it can help to step back and ask a different question. Not what else should I add, but what's preventing change? For many practitioners, this is a subtle but important shift. It moves the work away from chasing the next intervention and towards restoring capacity. Safely, sleepily, regulation, simplicity. What's interesting is that when the shift happens, protocols that previously went nowhere often begin to work again without being fundamentally changed. And that can be really reassuring, because it means the issue was never that you didn't know enough, it was that the system needed a different order of attention. In complex cases, progress often starts not with doing more, but with creating the conditions where change is actually possible. See you tomorrow, guys.